A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors. The U.S. Department of Health and Human Services has issued a warning stating that far too many young people are struggling with their mental health and unable to get the support they need. In the past few years, there has been a significant rise in youth mental health disorders, including depression, anxiety, and suicidal ideation. The Department of Health and Human Services is calling upon all of us to have a role in supporting youth mental health and in creating a world where young people thrive, especially since mental health challenges are the leading cause of disability and poor life outcomes in young people. Dr. Vivek Murthy, the U.S. Surgeon General, issued an advisory on youth and mental health in which he calls for warning labels on social media. We'll talk about that today. He says that current evidence reveals that social media is having a significant impact on the mental health of children and adolescents and outlines immediate steps that we can take to mitigate the risk of harm to these youngsters. His advisory also emphasizes the need to protect the mental health of minority and marginalized young people. He says that due to factors beyond their control, they are at an increased risk for mental health difficulties. In understanding the significance of these issues as reflected in what they are seeing right here in Western New York and how this is impacting us in our community, Horizon Health emphasizes that mental health is an essential part of overall health and that mental health conditions are common and treatable. Horizon also notes that we continue to suffer the repercussions from the pandemic. Why youth and mental health matters? That's on this edition of your Hometown Health Connection. I'm John DeSciullo. Welcome to this important discussion. Today, we'll be talking with Melissa Walter, Director of Child Adolescent Services at Horizon Health Services, and Erin Parr, Project Director at Horizon. Now, Melissa Walter has worked as a licensed mental health counselor with children, adolescents, and adults for 11 years. She graduated from St. Bonaventure University with a Bachelor of Arts in Psychology and obtained a Master of Arts in Counseling Psychology from Assumption College. Her experience includes having worked with children and adolescents in residential treatment, day treatment, outpatient, therapeutic treatment, and foster care. She specializes in trauma-informed interventions, dialectical behavior therapy, cognitive behavior therapy, and mindfulness-based interventions. Erin Parr earned a Master of Counseling Psychology from Yorkville University, a bachelor's degree in psychology, and a postgraduate diploma in addiction treatment and prevention. Born and educated right up the road in Canada, Erin has over 20 years of clinical experience in substance use and dual disorders. Her patient-centered approach to treatment focuses on working with the patient, family, and engaging them in the community. Erin has quite accidentally but enthusiastically embraced her role as what we'll define as the weed girl, we'll find out about that, due to her clinical work focusing on the psychological effects of cannabis use and brain health across the lifespan. Her experience includes 10 years as an addiction specialist in the early intervention psychosis field, supporting both adolescents and their families. Erin is in high demand as a speaker and in providing trainings and workshops within the healthcare, criminal justice, and educational sectors. Erin is passionate about providing accurate and engaging information on the intersection between cannabis, mental health, addiction, harm reduction, public safety, and the changing legal status of this complex substance. She currently serves as director of a new grant-funded program that focuses on delivering community-based prevention and assessment services to youth and young adults called the SAFER program, and an active member of the Horizons Speakers Bureau. So ladies, welcome to the show. Quite impressive resumes for the two of you. A lot to get to today. I hope we get to all of it. An important issue as to why mental health is very important with young people. So Melissa, we'll start with you. And I wanted to just touch base on the very first thing, and as I make sure I get everything set. Trauma-informed interventions. That sounds very complex. What does that mean?
Well, in the mental health community, we really need to consider all of the experiences a child or an adolescent has had when we're considering their mental health. And some of those might be a threat to their safety or the safety of their families, and they may have experienced trauma in some way. So when we're planning their interventions, we need to take all of that into consideration and how it's impacted their brain development, the development of their nervous system, and how that's developed into mental health
And
symptoms.
trauma
as
could
well.
be anything. Could it be a physical abuse, a mental abuse, all of the above? Right?
Absolutely.
Yeah, that's tough. Erin, you're seeing some of the same things the U.S. Surgeon General was talking about, counseling youth, when you go to Horizon. Tell us about some of the mental health conditions that you're seeing. The U.S. Surgeon General has said that mental health is on the rise with young people. What are you seeing at Horizon?
Similar to what Melissa just shared, we are actually treating primarily in children and adolescents trauma diagnoses and supporting young people with managing those symptoms, getting timely treatment and age-appropriate treatment for trauma. Those are the symptoms that we are seeing most in young people because of some of the adverse life experiences that young people have experienced, whether it's in the family home or out in the community or as a long-term impact from COVID. The next most common mental health concerns are anxiety and depression, which should come as no surprise. The population in general really does struggle with anxiety and depression. 1 in 4, sometimes 1 in 3 individuals may be struggling with those diagnoses. And children and adolescents have really sometimes some unique symptoms that are a little bit different from how those disorders might present in adults. You might see more complaints about, I don't feel well, I might have some headaches, maybe I'm not too keen to go to school. Right. Generally, some children do need some support around managing big emotions, managing emotions that feel maybe a little bit scary or uncertain, and building resiliency in children is one of the things that Horizon really focuses on in our child and adolescent program, to be able to teach young people the skills that are really going to benefit them when they're faced with, having to do life with these big emotions, but learning that they can do them even though it might feel uncomfortable, and they can do them with support.
Melissa, what do you think is causing some of these problems? And is it just because they're adolescents and they're just going through that phase and they're growing up, or are there deeper underlying issues?
I'm sure that's part of it, but I think there are several factors impacting them and really creating this mental health crisis that we're seeing in our youth. One of those factors, I think, is COVID-19. We all experienced that, and I think we don't fully understand the impact that had on children. Some of them were at different developmental levels, but we know it impacted socialization, education, the health of their families. Another thing is the legalization of cannabis. And while cannabis has been around for a while, the access to it for our youth has really increased, and access to very high potency THC in the cannabis products, and that really impacts mental health and brain development as well. So I would say lastly, maybe social media plays a role. I think social media has positive and negative impacts on teens. But the things that we really see are disruption of sleep routines, self-care, and impact on self-esteem.
Well, and Erin, we'll talk about cannabis in the next segment, because I know that's something that you've studied and have great knowledge on. But let's pick up on the social media that Melissa mentioned. I have a 24-year-old daughter, and she has a 16-year-old sister. And I'm not telling tales out of school, but social media is, particularly TikTok with the younger of the two, is so prevalent, and yet at the same time, it's not going to go away. So is it a question of managing social media use? And on top of that, what are those deeper impacts that all of that has, besides sleep and attention span?
Well, you're right. Social media is not going to disappear, right? TikTok, Facebook, Snapchat, Twitter, all of those platforms are very much embedded into our culture now. And what we are encouraging people to do is very close to what you just shared, which is that we want parents to be able to role model and help manage youth and their relationship with social media so that they can have healthier habits. When we're thinking about managing something in a healthy way without removing what that thing is, for example, the social media, we're not just going to have it evaporate overnight. We really want to teach young people to learn how to use those platforms within their limits. If they're using more than 3 hours a day, there's a good chance that the routine that they're creating is limiting themselves from engaging in other really healthy behaviors, such as being in nature, learning other new coping skills, socializing in real life, and taking good care of themselves and attending to their daily tasks and chores.
I was just going to mention the socialization part, because you see people who are sitting at the table next to each other and they're on their phones and they're texting each other.
Right.
And so that socialization, yet at the same time, social media can bridge, and FaceTime and other technological advances can bridge so many gaps. They can see their grandparents. They can, whether they live coast to coast.
Yeah.
So it's a catch-22 on so many levels.
It is, and to mention some of those deeper impacts, as you were asking about, there is a disproportionate negative impact of social media on young adolescent females. They tend to be a bit more susceptible to the unhelpful social comparisons, to images of perfect body types, or kind of the aim to reach a kind of level of perfection with how you're presenting yourself in the digital world. And those pressures and that constant exposure can be unhelpful and worsen pre-existing mental health conditions if a young female is already struggling with body image or eating disorders, but can certainly also contribute to the development of anxiety and depression.
And what they think is the perfect life. We have about 5 minutes left in our first segment. Let's talk a little bit about the connection that teachers have with young people. In many respects, sometimes the teachers play the role of parent. How do they help in this situation, particularly when it comes to diagnosing and helping with someone who might have a mental illness?
Absolutely. I think it's the most important thing might be for a teacher is to be aware of signs and symptoms of depression and anxiety. That way, when they see these things presenting in children and in the behaviors of children, they're able to recognize what it is versus just a negative behavior. Sometimes kids get labeled as behavioral in schools when in fact they're experiencing symptoms of depression that might cause them to disengage in ways that looks like resistance, right? So really knowing the signs and symptoms to look out for, the signs and symptoms of substance use, and that way they can be linked to treatment services that are needed.
Let's pick up a little bit on substance use. When I was a teen growing up, there were substances out there, certainly, and they're still out there. And do you see that the teens are just being dared to do it like it used to be when I was growing up, or are they forced to do it, or there's peer pressure? And where do they find these substances? I see it, whether it's an urban or a suburban or a rural area, it seems very prevalent no matter where for substance abuse.
Yeah, not much has changed since we were adolescents. The youth today, they have that added layer of social media influence, which I think does play a role today in some of the higher risk substance use behaviors that we see. There have been some TikTok challenges around engaging in high risk substance use behaviors that have had some really negative outcomes. The most common substances that we see young people experimenting with, number one is alcohol. It's kind of always been the number one, followed by nicotine and then cannabis. And interestingly, we are seeing an increase in experimentation with hallucinogens. That's a trend that's, kind of become more apparent over the last year or two. Because of social media influence, and also because there's this growing kind of field in psychiatry where hallucinogens under medical supervision are potentially being used as a treatment, but young people are hearing that, not understanding necessarily the nuances of that medical treatment, and kind of taking that experimentation into their own hands.
It seems like a lot as a parent, coming into the world, but at the same time, with what you're doing, Melissa and Erin, at Horizon Health, you're helping these young people overcome these addictions, or at least manage them, I would think, too, right?
Absolutely. Some of the programs that we have available, we're able to meet the children and adolescents right where they are. So some of what we do is right directly in the schools. We're out in the community and trying to see the kids where they are so that we can reach higher numbers of them.
We work with an agency called Prevention Focus. I don't know if you've heard of them, but they get into the schools as well. And at a young age, very younger than I would have expected. We're going to continue our conversation here with Melissa and Erin, and we'll be back with more on mental health and children and young people right after this. Buffalo Healthy Living Magazine is a free, full-color magazine distributed throughout Western New York. Now, more than ever, as we all want our families and friends to be safe and well, Buffalo Healthy Living magazine is devoted to health, fitness, and nutrition for people of all ages. It's a great read and also has great recipes. Pick up Buffalo Healthy Living magazine all over our hometown or go online anytime at buffalohealthyliving.com. Welcome back to your Hometown Health Connection. We're talking with Melissa Walter and Erin Parr from Horizon Health Services about youth and mental health. And Erin, it was interesting to read your bio. There's a description of you as the weed girl, which we'll get to that in a second. But I guess what that means is that you have that expertise in cannabis. And we were just talking during the break about not only about the use of cannabis with young people, but also how that parental and peer dynamic works. You know, if the parents are users and they're telling the children not to use, it's kind of an odd conundrum. But, so talk with us about everything that you can in a short window about cannabis.
Wow, that's a tall order. I could spend an entire day talking about cannabis. It's my specialization. I spent quite a large amount of time clinically working with adolescents and their parents around the treatment of cannabis use disorders and the connection between cannabis use and mental health. The tricky thing about cannabis today is that there are so many mixed messages about the safety of cannabis, the benefits of cannabis, the risks of cannabis, and so a lot of young people actually don't have great information about how cannabis, especially being used in really early ages at very high potencies, how that can impact brain development. Parents are also really busy, and they may also have pro-cannabis attitudes, pro-cannabis lifestyles, and they may not fully also understand that the impact of cannabis being available in the home, safety considerations around child access, all of those things can make it really difficult sometimes to have clear and accurate conversations with young people about cannabis.
And you had mentioned something interesting before the program, that when I was growing up in the 70s, the difference between cannabis then and cannabis now is?
It's shocking. And just to give a bit of a comparison, the average THC content, THC is the active chemical in a cannabis plant that causes the high, the euphoria, the impairment. The average THC concentration in 1969 was only 1%. Today, we have products available in the community that are accessible to youth and accessible to young people that can be anywhere from 80 to 90% THC in concentration. So we're really talking about a very different drug, a very different substance, and we're still just beginning to learn about some of those negative impacts on brain development, as well as the impact on future mental health concerns, including anxiety, depression, risk of increased suicidal ideation, and in some cases, psychosis.
And it seems as if cannabis is not going to, the acceptance of cannabis is certainly not going to roll backwards. It's, if anything, going to move forward as pieces continue to be legalized and dispensaries continue to open. So I would suspect, Melissa, maybe you can jump in, this is kind of like how alcohol might have been at one period of time. It's just, it's there. We're not getting rid of it, so you just have to figure it out.
Alcohol is still there. It's still one of the most, largely used substances as well. So our programs are targeting all of these substances, including vaping, cannabis, alcohol, other high-risk substances as well.
I've often heard about gateway drugs. Does one generally lead to another somewhere down the line?
I think there's some controversy around that. I think if somebody is using, cannabis, they're more likely to use other substances, but I don't know that cannabis is necessarily the gateway. But I think there's a lot of controversy where that's concerned.
Well, let's move now to some of the services that you offer, Melissa, at Horizon.
Absolutely.
We talked a little bit in the previous segment about how you work with families and teens. Is it something where somebody can come right to the Horizon Center that's closest to them? Should they make an appointment? How do you interact with that person? And there should not be a stigma about coming to you, should there?
Absolutely not. And we have those traditional clinics, Erie County, Genesee County, Niagara County clinics, where people can make an appointment and come right in and see us in a clinic. And we are also out in the community. We're out in schools. So we have currently 25 schools that we're working in Erie, Niagara, and Genesee counties as well. And we have counselors embedded right in the schools so they can see teens, like I said, right where they are, reducing the barriers to parents getting kids to services. There's busy schedules, transportation issues, right? So trying to see teens where they are. I know that right now we're in development of the SAFER program, which is really going to allow us to get out in the community and do some free substance use screening. We're going to be able to provide some brief intervention and referrals for teens who are vaping or using other substances as well. So that's an exciting program we have on the horizon. One of my favorite programs is also our trauma-based program. So we received a large grant from SAMHSA, and it was part of the National Child Traumatic Stress Initiative, and that allowed us to do a lot of training for our teams in trauma-based interventions and hire more staff so that we can reach more children and adolescents in that way as well.
So what happens to a child, no matter what it might be, it sticks with the child. It's something that sometimes hangs with them for the rest of their lives, whatever that trauma might have been.
Absolutely.
There's something that we talked about here, Erin, called intervention psychosis and harm reduction. Those sound very complicated. What is all of that?
Yeah, those terms might be new to some of the audience listening. They are also really important terms to become familiar with. So I'll start with early intervention psychosis. As we've been talking about, there are a number of mental health concerns that can impact young people, whether it's substance use or mental health. And the earlier we intervene, the better the outcomes for the child in terms of their functioning, their future mental health, their ability to achieve important life goals. And one of the things that we do want to intervene early with is when we see young people in distress experiencing symptoms of psychosis. And the reason that I became familiar with psychosis is because there is a connection between cannabis use early on, especially cannabis use prior to the age of 15, and then having a 4 times greater risk of developing psychosis later on in life. Psychosis symptoms look like confusion, paranoia and suspiciousness, maybe hearing things that aren't actually happening, seeing things that aren't actually happening, some strange ideas that are not grounded in reality, and some confused thinking. And it is a mental health crisis. These are symptoms that we want young people to get treated right away, seek medical attention, and we want to wrap supports around that young person really quickly so that they can recover and move on with their life.
Yeah, psychosis sounds pretty serious if somebody were to have that, no matter what their age.
Yeah.
Let's talk about dialectical behavioral therapy. Dialectical behavioral therapy. What is that and how does it work?
So dialectical behavioral therapy is a type of cognitive behavioral therapy, and the goals are really to reduce emotional instability, help children and teens develop more skills for managing their emotions, for building healthy relationships, for coping with distress, and mindfully living in the moment. There are just so many pulls on attention, and just being able to be in the moment is so important, so you're not missing what's going on right now. So we have a dialectical behavior therapy program at Horizon where children attend with their parents, a multifamily group, and learn skills to help cope and manage their emotions and manage stress. And that also involves individual therapy, family therapy, after-hours phone coaching, and medication management.
Do you find that the young people are more apt to be more open without their parents or with their parents? What do you see?
Yes, in individual therapy, I think sometimes teens are more open for sure, and there's confidentiality where that's concerned. Our groups where we involve the families and in our family sessions, we're really teaching skills to everybody to help them manage things that arise outside of session. So when they're having conflicts in their homes or stressors come up for the whole family, being able to manage that together is really important.
We have about 5 minutes left in,
Sure.
our program overall. I'll throw a new one out at you. I would suspect that this economics has nothing to do with it. If a family comes from means versus a family that's struggling, the issues may still be the same no matter what. It crosses all lines, doesn't it?
Absolutely. I think socioeconomic factors certainly play a role in the level of stress a family might be experiencing, or all of the challenges they might have in how they're able to access treatment. And that's why we're really trying to reduce those barriers.
Yeah, so no matter what the situation, reach out. Erin, I know that you do a lot of speaking engagements. What do you talk about, and what do you hear as feedback when you go out into the public?
So cannabis, as no surprise, is my favorite subject to talk about. It is the topic that I'm most passionate about, making sure that adolescents have really great information on how to make decisions around safety and their use of substances to protect their brain, because they need their brain for the rest of their life. So I talk on a variety of subjects related to cannabis, including harm reduction, which is teaching individuals strategies for managing their use in a safer way without necessarily having the aim of reducing the drug use itself. Sometimes, young people and adults are not always in a place where they're ready to make a change. And so helping to improve the health of the population and the health of the individual and the community at large is really about teaching ways that people can be safer and more mindful and more thoughtful about the use to reduce negative consequences. So the topics that are often asked for in community settings are cannabis education for youth and parents, harm reduction interventions, and the impact of trauma, to be honest. It's a hot topic when it comes to adolescent and child mental health.
In our few minutes left, let's pick up a little bit on harm reduction. What would some of those harm reductions be that someone could act on?
Right. I'm really glad that you asked that, because teaching people specific skills is really important for helping them to not just be safer, but also potentially save their life. So the number one harm reduction intervention is to really be thoughtful about when you're using, the setting that you're using, and also the mood state that you're in prior to using. So are you in a safe place? Do you have sober people around you that can help take care of you if you don't have if you end up having a bad experience? Are you able to have a good meal before you choose to use? Are you able to be mindful of how much you're using? The other significant concern in our community right now is fentanyl contamination, and there are risks with all substances with fentanyl contamination, so making sure that you've accessed the safest possible product. I know when we're talking about children and adolescents, it's not legal for them to purchase.
I was just going to say that.
Right? And so they're often obtaining products from friends, from family members. There may be products in the home that are not kept under lock and key that we would really encourage parents to consider locking up, and encouraging young people to really understand the nature of the risks, because sometimes experimenting with one thing one time can go a little bit sideways, and we really want to prevent young people from having negative outcomes.
Well, this has been an amazing half hour. I appreciate it. We've talked about how fast the time's going to fly,
Absolutely,
right, Melissa?
yes.
And hopefully we'll have you back. There's so much to talk about as the discussion continues. So thanks, ladies, for sharing.
Absolutely.
Melissa
it was nice
Walter,
to be here.
Oh, thank you. Melissa Walter and Erin Parr from Horizon Health Services. And we're going to have some important contact information right now, so stay with us. Learn more about some of what we discussed here today regarding problems that we are seeing among youth. And there's a website, hhs.gov. That's the U.S. Department of Health and Human Services. All you need to do is search mental health, and you'll see all kinds of articles come up. And you can learn more about Horizon Health Services and the services that Melissa and Erin talked about today at their website, horizon-health.org. That's horizon-health.org. And there's a phone number to call. It's 716-831-1800. You can make an appointment. You can call and get advice. Don't need if you need to reach out, 716-831-1800. I'm John DeSciullo. Thanks for watching. Be safe and be well. A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.